Welcome to It's All About the Questions, where learning to ask the right questions can help you achieve lifelong success. Now, here to help you ask all the right questions is award-winning author, international speaker, and business strategist, Laura Stewart.
Good morning, afternoon, and evening, everyone, and welcome to the show. I know I've been absent for for all of July. I had some unplanned emergency surgery, and I have been recovering ever since. So I'm excited to be able to get to do this show today. I'm excited to be here. I've got amazing guests for you, and the topic is so incredibly relevant considering everything I've been through this last month health-wise. And I'm excited to have a friend from the tech world on the show who, we've known each other through different avenues for a long time. And she happened to post in a Facebook group I'm in called Tech World's Half that her new app that she just created with Dr. Marta Becker has been released, and it's called Journal My Health. And I was so excited about this because this idea of keeping track of your health so that you can better communicate with your doctors using the same language was incredible to me. And I couldn't believe that nobody else had really created an app to do this. The two of them created the app because of long haulers and COVID, but it really applies to anybody that's having long-term health symptoms so that you can easily track how you're doing and your progress. So please welcome to the show. We've got Tracey Welson-Rossman and Dr. Marta Becker, who is an otolaryngologist, or as most people know you as an ENT, right? So welcome to the show. I'm excited to have you both here.
Thanks so much.
You know, when I first saw that you had the app, and I did download it to my phone, and I was using it up until the whole hospital thing, I was like, this is really, really cool. Number one, that you went to a health app. And number two, that you took very specifically long haul COVID as the reason for starting this, because there's a lot of people that don't believe it exists, right? Except for the people that are going through it. And it's something that isn't really talked about in the press either. But when I saw this, I went, you know what? I can use this for what's going on, some of my chronic stuff as well. So I don't know if Dr. Becker, you're the first person to start it, or Tracey, what was the tipping point for you guys to say, must create this app?
I think Tracey should hit that one.
Yeah. So actually this goes back a while. So this is actually based on my experiences as somebody who has a chronic condition. But mine started 20 years ago, and about 8 years in was when the smartphone came out. And I was talking to my neurologist, and I'm like, wouldn't it be cool if you could keep all your information in your phone? Because this was like back, the wild, wild west days, right? The early days. So that idea was, sort of new, and kind of went down the path a little bit of like trying to figure out, my day job is I work at a technology software consulting firm. So I'm immersed in technology, and certainly always helping companies figure out how to use tech, either for their services or to, put their product out. But the idea got put aside due to the founding of Tech Girls, and that took up some time,
right.
And didn't bring this back up until last year, when the CEO of Chariot Solutions, where I work, said, hey, we have some time right now, if anyone has an idea. I wound up having a flare, and had done my first telehealth with my PT, and I was like, I think it's time to bring this back. And that was probably in, when we started talking about it, April of last year. Long haul, I think, started coming out around June, and I think I met Marta sometime maybe around July.
Yeah, July, August.
Yeah. So we're recent. I mean, we're like peas in the pod. Like we are definitely like the introduction, the person who introduces definitely a matchmaker. And it was just like perfect timing because when you start a company, to find a co-founder is hard because like it's a marriage, but we can talk about that.
Totally.
That's a whole other subject. But the reason I want to go down the long hauler path and why it's long haul and chronic conditions has to do with my experience with my journey. And
Okay.
even though what went on with me is so much different in terms of the treatment and the logistics of it, how the operations of figuring out what's wrong with you, going to the doctors, the tests, the amount of paperwork, the in between appointments, having to explain what's going on when you're in that diagnosis phase. And then you move from diagnosis phase, hopefully into treatment phase. And then from treatment, you go to maintenance. And maintenance, when you have a chronic condition, and long haulers, from what I have read, and I think Marta can agree with me at this point from the medical standpoint, is it is going to be a virus that kicks off autoimmune issues, right, and other chronic conditions. So long hauler will be how you got this particular, whether it's chronic fatigue syndrome or POTS. That's what's going to kick it off. So the idea behind the app is, how are you keeping all this information together that's self-reported? But the kicker here is that we are adding, I couldn't have done this 12 years ago because this did not exist. So biometric devices. And we're also taking some data that's being collected behind the scenes on your phone. So we're taking environmental data, which happens to be the weather, but environmental is also your heartbeat and your activity level. And how are we combining that with patient-generated, self-reported data? So all of this patient-generated data can then be put into a reporting structure that can then be sent easily to your doctor or printed out. And one of the things that we have to understand, we are coming at this from the patient standpoint, but you have stakeholders in your healthcare providers, which is why it's so important that Marta's with us, because we're the patients. We understand that journey, but we don't understand the other side. And we need to have a good understanding of how that doctor or healthcare provider wants to interact with that data. So I'll just stop right now, but that's basically the premise of it. So there is I hate saying that there's a universality to chronic conditions, because of course each one has its own pieces and parts, but there is that infrastructure of how you're dealing with all that information. And now that I've put this out, I hear so many stories of people I did not know had issues, or a family member has an issue. And it's the same thing that they keep telling me. There's so much, they're dealing with so many doctors. They have to retell the story again and again. They can't remember everything. Mm-hmm. And the biggest thing that I learned from Marta in one of our early conversations is that doctors are detectives, and they're looking for
some doctors. I'm just going to say that.
Well,
some doctors are detectives. Other doctors are just, like, you have 10 minutes with me and this is probably what you got and you're out the door. We want more doctors.
I'll try and put a positive spin, because we did talk to doctors. Marta and I did do, our customer journey. We did the customer journey with the patients. We did the customer journey with the doctors, and they don't have as much time. And that is correct. They do have 20, 25 minutes. So having this story put together And I'll send this over to Marta now. So I think that's that's a good segue for you.
Yeah, that's right. I mean, ideally, we're all detectives, and I'm not going to like address bad apples or whatever, but I think it's helpful. It's hard for patients to understand, but helpful, especially if you have a doctor that, you trust and you think is trying to help you, to sort of also give them the benefit of the doubt and be like, wow, how can I help them help me? You know what I mean? Like, I'm not going to go in and put it all on my patient, like, well, you're not telling me what I need to hear. But in order to make it a really functional relationship where everybody has the same goal in mind, it's really important too for the patient to kind of, it's funny because I like the name of your podcast, like it's all about the questions, because
Thank you.
I mean, I say that I say that to my medical students, like you got to ask the right questions and so does the patient, right? So,
and you have to ask it of the right doctor as well.
Yeah, right. I mean, if you don't have a good relationship, you have to move on. Like if you've lost confidence or whatever, but especially with something that's hard to sort out, coming in with kind of pre-digested thoughts about what could be going on or what kinds of questions are really like the most valuable is super helpful for patients to kind of prepare for a visit. And Journal My Health, right now where our focus is on a lot of like tracking and journaling. So we're pulling in a lot of data from like Tracey said, from weather, biometrics, self-reported symptoms, which we think is really important and really different, because a lot of the apps out there are apps for things like migraine or mood, but they and research studies in general force the patient to answer only the questions that the clinician wants the patient to answer. So with something especially like long COVID or maybe an autoimmune disorder that's new that we don't know what category it's going to fall into, being able to ask the patient, well, what's really going on with you? All of the things. What do you think is important is really different. And I think, one of the things that I was taught in medical school, ask the open-ended question at the beginning and then go from there, So we're really trying to capture that idea that the questions that the patient brings and that questions that the doctor can ask are the most important things that happen in an interaction, and it is time sensitive. So having an organizational plan with your app, which eventually will become probably more of a platform to organize care, is really important. So I think Tracey was it's very timely with COVID because there's so little known about it, and we're only a year into this pandemic, really, in this country. So understanding, who is going to have lasting symptoms and who isn't. Some people get better from long COVID. That there's a lot of people that do get through it and seem to be out the other side. But we have to understand, what's going to happen with these people. And we really believe, not to get ahead of things, but we really believe too that when patients collect their own data, that will probably be data for a much large. I believe that will be data for a larger study later on. That's not that's more of a like, let's collect a large population study.
Yeah. And one thing that we'll be doing in the fall, because we are talking to so many patients, people who have chronic conditions, they're journaling. They may not be journaling in the most, organized way, but they're taking notes. And there's very few studies about patients who are journaling and how they have interactions with doctors. So we want to do a survey to see how many people are actually journaling so that we have a better idea, because I believe it's a lot more than the medical community has us even realize.
It's a lot of people. They bring their journals in. I see them.
The binders.
Binders, right?
Notepads, yeah.
I have a binder that has blank pages in it, and like it's a day planner, and then it has a calendar, so I can write certain information on each calendar date, like everything I took, supplement, medication, whatever wise, and I'll always jot a little note in there about how I'm feeling, and then there's blank pages for more involved conversation, or if I want to track food for whatever reason. And when I downloaded your app after I had seen your post, Tracey, what was really interesting to me was how much is in your database behind the scenes, especially around medications and supplements and different things like that. There's very few things that are out there that take that holistic viewpoint of a person. And that's why I wanted to have the both of you on the show, right? Because I think, as you said, Tracey and Dr. Marta, you said that as well, the world's shifting to the way healthcare is sort of beginning to function. COVID escalated the teledoc, the telehealth appointments, where a doctor's not even physically in the room with you sometimes. I get notes from my insurance provider saying, you can just go onto this app and find a doctor, somebody that's actually never seen you in person for whatever reason. It's really great if you've got some cold symptoms or whatever, but that person can't palpate. They can't, you kind of stick your tongue out in the camera and everything, but it's not the same. And having a journal created with a doctor and somebody who's been through chronic health situations, I think is a really great way to get people to start asking different questions about what's working in healthcare, what's not working in healthcare, what's working in patient-focused care versus non-patient focused care, right? So if you're going to a specialist or you're going to internal medicine or a family practitioner, it's a different kind of conversation. My listeners all know this, and Tracey, you may know this as well. For 3 years, I've been dealing with Tullio syndrome and hyperacusis, where certain frequency sounds will literally, I can black out. Wow. So COVID to me was wonderful in that everybody else was stuck in their house like I had already been for 2 years. So for me, I was like, it sucks that it's COVID and that people are dying, including people I know, or getting long haul or getting sick. But I felt like, oh, okay, I'm not missing out on anything. People now understand what's going on with me, and I can get back out in the world. But I had to learn the hard way over years because I had been misdiagnosed several times. I mean, I had a chief of infectious disease of a hospital tell me I was sick because I was depressed because I wasn't with a man. I had babesiosis from a tick bite, and it had gotten into my brain. I lost 30 IQ points. Wow. They didn't notice it because I started at a 160. I knew I was hurting really bad and there was something really wrong. Finally, my doctor got me to a neurologist from Israel because he's like, you went to Israel. Maybe you picked up something there. And the guy's a Lyme specialist, and he goes through my records, check it this big, pulls one piece of paper out as he's still asking me questions. And he said, it is in your head, but I can get rid of it. You've got a bug in your head throughout your body. So he knew to ask certain questions. So that's really important. And I had every test that had been done, and I had notes I had taken. Your solution makes it easier now because it's kind of hard to refute day by day kind of things. But if you don't get to the right doctor with this information that understands it, right? Understands the data. I mean, Marta, you've probably had people come in who had a sore throat, or their ear itched or hurt and they're going like this, trying to figure it out. Those are wonderful things for an ENT, but I happen to know my ENT diagnosed me with GERD before laryngeal reflux before my GI doctor did, because they looked in my throat and went, yeah, that's not the normal sore throat look.
Yeah, we do.
So my question becomes, when you were putting this together, what questions were you asking yourselves to make sure that you could capture the data and have it be valuable for the patient and the healthcare provider? Long way around to that, but I need to stop.
Marta, you start and then I'll take it.
Yeah, I think one of the important things, like we started out with some of the chronic symptoms of COVID. That was kind of our jumping off point. We looked at what are people struggling with this disorder, but I think that we quickly realized that we really did also want that open-ended piece there. So I don't know if you know this about the app, but there's a menu of things you can choose from. Like, I want to keep track of my dizziness or my fatigue or my heart palpitations or whatever. But there's also a way to add in anything you want. So if you have if your ear turns red, we didn't put that in as one of the symptoms, but yeah, there it is.
Yeah, there it is.
Trying to get it so people can kind of see these different things.
Whatever it is that you're.
Laura's going to be doing a customer journey report with us.
Oh, easy. I was in IT. I owned an IT.
Yeah, I know.
Computer science degree, geek.
And the same is true with your treatment. So, if you're doing a treatment, an alternative treatment that we didn't think of to put in there, like you're doing a neti pot with golden seal or whatever, just throw it in there, if you think it's relevant. And the whole point of the app is that it's going to help us sort out what's relevant and what's not relevant, right?
Right.
That's the whole idea behind the making graphs and correlations, is that we can say, it doesn't seem to make a difference if the golden seal is there or not. But it seems that it does make a difference if just the fact that you wash every day, or your nose. I'm talking about nasal symptoms because that's my world. But my point is, that's the whole idea that an app can do these simple things now, but over time, add even some AI in to sort of, maybe we're hoping someday we can download the labs and everything that's positive will come into a little, these are the positive findings and these are the negative findings. And, it will help organize your data so the doctor doesn't have to honestly go through the pile, because it's hard to do that. It takes a special doctor to go through a big pile.
And I think coming from the patient side, again, these two worlds have to meet. But coming from the patient side, I learned from my care team how important it was for the symptom wasn't always the indicator of what was wrong. It led to other things. So I was probably more attuned than maybe somebody who wasn't coming at it with my background. Now, the other thing, because I've got Chariot Solutions, who is an investor in the new company, so they've been doing the development, and we're using the same process that we use with any of our clients, which is going down and doing the customer journey, making sure, I have my standpoint and Marta has her standpoint, but we have to talk to people who are using it or would think about using it. We have to make some assumptions as, the creators, but we also need to make sure that we're listening to those who are impacted on a daily basis. And we need to, we're going into our next version and we're creating that product roadmap. And we need to go back out to people who are using it. Laura, I'll be calling you. But we also need to talk to the doctors, because we want to make sure that when you come in and you show them this data, that they're going to be, they have 20, 25 minutes to see you.
Some only 10.
Are we giving them the view that they need? So I think that that's important. And just one last point, I think, we have to think, yes, Marta's looking for patterns. Doctors are looking for patterns. That is the community. But Laura, I know we're individuals. So there are nuances to what is happening to us. And you could be that, you see those drug commercials and they'll say, you may experience these, all of these symptoms after taking this drug. And we know that it's probably for 0.0001%, but you could be that 0.001%, or you could have something else that, crept in. How are we in the healthcare continuum, making sure that the individuality is also captured?
I love that, because, when I was in the hospital, they gave me a drug called Carafate for my stomach, because they thought maybe the ulcer perforated or whatever, right? And I started having breathing difficulties, and they kept telling me, "Oh, you're having a panic attack. You're anxious." And they were trying to give me Xanax and everything. And I'm like, no, 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 this is not that. There is a complete difference in the way you feel when you're anxious versus breathless. And I finally Googled it, right? Found out facial swelling and breathlessness is a side effect. They refuse to believe me because it's a rarer side effect. So I literally stopped the nurses from giving me the drug, and my
Yeah.
symptoms went away. And they're like, that can't be it. I said, so do I have to die in here first, take another one of this pill, and you can watch me and watch the symptoms come back? And then another doctor that they came on duty and they mentioned it to him. He goes, she's having a severe allergic reaction. Are you idiots? Stop giving her the drug.
Uh,
So,
I think
I
one of the
love,
things that the app can only do so much, and
right.
we want to be careful as we move on. Of we're not going to give a diagnosis like that's
No, but just
right.
letting somebody list that and then maybe pop up when you see a new medication like added.
Well,
Say,
this is the point.
what's changed?
This is the point that you can quibble. Say you and I, Laura, say we didn't agree. Say I was like, nah, the Carafate's not giving you an allergic reaction. But you said to me, listen, at 8 o'clock, I took this pill, and at 9 o'clock, my face swelled up and I had trouble breathing. And then I got better. And then the second time at 8 o'clock at night, the same thing happened again. And the next day it happened again. Then I can sit here and say, listen, I still don't think it's an allergic reaction. Whatever. It doesn't matter what I think, because the fact is you have data that says I took the pill, I felt like crap. I took the pill, I felt like crap. And we can quibble about the reason, but the fact is the outcome's the same. You stop the pill. So that's where, to answer your question about like, how do you get doctors to listen to you? The answer is you just come with hard facts,
Right.
You can insist on reasons for things to happen or not. And unfortunately, doctors and patients get in that fight all the time, but it's a useless fight because the common answer, the goal is the same, for the patient to feel well. And even the most like hard-boiled nasty of doctors is still going to, say, yeah, I want my patient to feel better, and if a patient says, look, I take this thing, it doesn't work for me, and has keeping track, and look, here's the thing, there's no other answer. It's going to not happen anymore. So I really feel that that's one way to cut through some of that relationship stuff. And I think you've just given a really nice example of a way in which you tracked your own symptoms in your mind this time, right? Not on a piece of paper or in a phone, but you tracked it yourself. And I said, look, this is a correlation, and that's what we both need to understand.
Right.
Yeah. I love that the app gives you that ability to do it really easily. Now, I didn't use it while I was in the hospital because my fevers were high. I just knew what was going on, and, but there are a lot of people that don't have my medical knowledge. Okay. I'm really good at patient advocating. My dad had Parkinson's. My mom had chronic heart conditions. My brother died when I was 10 of a congenital heart defect. So, I've learned over the years how to read blood work, how to read a CT scan report and see the nuances and all of that. But I'm not the norm when it comes to healthcare knowledge, right? I research the heck out of things because of the issues that I've seen, right? So to most of my listeners that are listening to this episode right now, or maybe watching it because, we record the video and everything as well, what do you say to them when they're starting to embark on using this, or maybe they've never thought about journaling what might be going on with their health? What do you say to them to help them begin this conversation? Not like, don't even worry about the doctor right now, but this is a conversation they have to have with themselves.
That's right.
Right. So I'll take it from the patient side. You want to take it from the, from the patient side, just like anything, this is discipline, right? You have to make sure that you are doing this daily. We have a reminder in there every other day, because the more information you're putting in, the more data, the better. That's one of the reasons why, and not everybody, I forget, and it's my, it's my app. But I forget to do it on some days. That's why I think the more that we can bring in what I'm terming passive data is already out there, because you're still tracking some things.
Yep.
And then from there, again, it's discipline. It's taking a look. Your health is a job, right? And getting better is a job that you have to take on whether you like it or not. Then, going through and saying, okay, I did not sleep well for 3 days in a row and my arm hurt. Maybe there's something there. Or, for me, it's always been, and it took me a while to figure this out, but there's definitely a correlation between weather and certain body parts, especially in my neck. And, early on, hurricanes would come through. I remember I thought I was going to chop my arm off. But, when you start being able to recognize that, I wish I had had the data at that point to be able to go to my doctor to say, okay, maybe there's nothing we can do here, but this is definitely impacting how I feel. Mm-hmm. And then I can have the whole point is, and you understand this, Laura, and I understand this, and I think Marta understands this. We as patients, we are consumers as patients, we have to take responsibility and be active in our journey, in our recovery, and our maintenance, because this is another sort of secret that if you're on, you have to be in the chronic condition club, unfortunately. But when you have a chronic condition, most likely you are not going to be like you were before. So right. You have to understand that there's a new level of normal for you, and what's that bar? How are you keeping that? Because there will be flares, things will happen. So, I'm here in a good stead because I've been, I'm disciplined about it. But if I think I may have had a better experience in the early phases if I had been tracking.
Right.
And as we were going through the diagnosis and the treatment phase and figuring out what was going on, that would work for me. So knowledge is power, especially with this, and being able to articulate what is going on and talk to your doctor about it, I think is really important.
Yep. Yeah. The world's kind of changed, and then we'll go over to you. I remember when my dad first got diagnosed with Parkinson's after not being able to figure out what was going on. And, I then proceeded to Google like crazy everything I could about Parkinson's and medications and treatment plans and everything. And I sent my dad a list of questions because he was in Florida and I lived in Connecticut at the time, and I couldn't get to that appointment. And it was way before doctors would allow you to bring a phone in with an extra person, right? Mm-hmm. And the questions were things like, what can I expect to happen? What about side effects? What are things I need to begin thinking? Like you just got diagnosed with a disease that will kill you and change your life. And he said, well, I can't bring those questions in. And I asked him why. And he said, well, the doctor doesn't want to have me asking questions. I just need to do whatever he says. What do I do if he won't listen to my questions?
Oh my gosh.
And I just, on the phone with my dad, and I'm almost in tears, and I just wanted to get on a plane. I said, if he refuses to answer your questions, you walk out the door and we will get you another neurologist. Right. Because you cannot be going into this horrible disease with a doctor that refuses to listen to you. The world's changed, right? Yep. Because people are more educated now that the internet is right. So easy to WebMD and put yourself down a rabbit hole. So Marta, Dr. Becker, from your viewpoint, how does that work for you and from your perspective, pulling all of this together?
Well, I think there's two phases. And I think it is important to understand that that I consider, like when I have a patient, we're working on something that we are in a partnership. And so sometimes people will come in and I'll say, well, how are you doing? And they're like, well, I'm kind of the same as the last visit. And I said, okay, so did we do all the things we discussed? And they say, no, I didn't do any of them.
That happens a lot.
Right.
Totally.
And I go, oh, well, but that's more like a aside. I guess what I was going to say was the one thing I really liked about this app, and Tracey and I have talked about this before, is that it allows both the patient and the doctor to be detectives. So the patient's so much more involved now in their own care, and in some ways you can see that as sort of like offloading the responsibility, but I prefer to see it in a more positive light as sharing the responsibility. And I think that when patients are empowered to understand their own experience better, and I think journaling, whether it's our health or our mental health or our relationship, I mean, journaling in general, I think helps us to gain insight over our experience.
Right.
I think that act helps the whole journey, even doctor aside, right? Put the doctor aside. It's just being able to understand what things help you, what things hurt you, what are your patterns, is an important part of being a patient or even just being a person. So, and I got to tell you, I think, it's an excellent tool for long COVID patients, and it is an excellent tool for people with chronic conditions. But I actually think it's really a very generalizable tool for even people with something like headaches or like PMS or like, arthritis or something. I mean, you could almost make it about anything. And that's kind of what I love about it. Because it even takes the doctor like out of the picture for a lot of us and just says like, I have this annoying thing that keeps happening to me. Why? When? And there's no doctor that's going to be able to tell a patient that. That's just going to be the patient figuring it out,
So these apps, MyFitnessPal, right? People track everything they eat and do all that. Why can't we track our health?
Right. Well, and hopefully at some point, MyFitnessPal will be part, an API that we're going to bring in. That's these are some of the things that we're thinking about.
Yep.
If you're putting that information in, why can't you bring that into our app? Hopefully that'll be, this again, like what do we need to bring in? Is there a food journal? Well, MyFitnessPal does that. Marta and I have talked about, and I'm hoping that we're going to be able to do this in the next go round, bringing in tracking cycles, a woman's menstrual cycle.
Right.
I think that we know that hormones are going to screw with your medication that you're taking. It's just happening.
You have a different body in your two halves of your cycle. Your estrogen cycle and your progesterone cycle are just two different bodies, and they can behave very differently. So it's good to know when you're living in.
So having that information, we talked to, unfortunately somebody who was a cancer patient, and she said that she was tracking to see when, and she wasn't sharing this with her doctor, but she was figuring out when were good times within that, the chemo cycle. She would be able to figure out when she could have lunch with somebody or, coffee, because she had an idea of when, what was going to happen when, because it was pretty consistent. So, we are talking to long COVID, we are talking to chronic. Probably, future investors will say we should be focused. But, we did create this with the idea, again, this is coming from the tech side of also just thinking about, how your database is structured and, can we skin this, could we bring somebody in? Right now it doesn't ask you for your diagnosis. We're probably going to be putting that in at some point if you choose to put it. So, a future plan on the roadmap would be, well, if you put in that you had chronic fatigue syndrome, the things that were more likely to be part of CFS would be the ones that would come up first. So there's some interoperability between, these different, but we've only been out for 3 months. So we have lots of things on the roadmap. One thing that I do want to mention, and why I believe journaling is going to become even more important. It is, we talked about earlier about the consumerization of healthcare, and when I say that, I mean it from the consumer, the patient side, the person side, not the clinician side, and how there's going to be a shift where, and it seems like, oh, well, it's healthcare, it's about the patient, but I feel it's more about the group versus the individual. When we take a look at what's happening in terms of economics, we have to take a look about how are we creating cost savings that make sense, that aren't about draconian methodology of or raising healthcare rates. The reality is that almost half the country has some sort of chronic condition. Which is sad, but it's a reality.
Yeah.
So we need to do something to acknowledge that healthcare, the healthcare system, is part of the equation, but how are we bringing in the patient, the individual, the consumer of these services, so that we are being more effective, we're being more efficient, but we're not, losing the humanity of when you're dealing with something that, is emotional.
Yeah.
Right. When you're not feeling well, it's emotional.
And when you're in that emotional state, like the day I showed up at the ER, I literally grabbed every supplement, everything, threw everything in a bag, took my notebook that tracked and charted everything of everything I had been taking, and blood work. I printed out recent blood work and all of that, thanks to Quest. But when you're in that emotional state, if it goes from chronic to acute, and you're a little delirious with 102.5 fever, somehow, if you're alone doing that and somebody's not advocating for you, I feel like the app can help provide some background or detail, because people are beginning to travel again. You don't know where you're going to go.
Right.
I mean, I remember going to Israel with some friends, the one that after that my symptoms started, and I spiked 104 fever after floating in the Dead Sea. And do we go to a doctor? Do we not go to a doctor? There were 3 of us. And finally they got me to a pharmacist, and he didn't speak English and I didn't speak Hebrew. My friend spoke a little bit of Hebrew, and she's trying, but not medical Hebrew, to talk to, because you go to the pharmacist there for a lot of different things. And finally he points at me and starts to point to different parts of my body. And we were able to translate, those kind of things. And thankfully it was just something, and I managed to get the fever down. At one point it hit 106, but we still didn't, yeah, it was bad. But I got the stuff and we were good. The app seems to help for that chronic kind of thing, help with a historical perspective for somebody. It's not going to help, say, with the acute that might be happening.
Right. Yeah.
But what, COVID's an acute thing that then can become a chronic thing.
Correct.
Right.
So can you guys explain, perhaps, Marta, in a better way? I don't know if there's a better way than what I just did, but, acute versus chronic, and why it's so important for the patient and the caregiver to understand the difference, and how to talk to your doctor about those kind of things.
Yeah. Well, it's all about timing, right? So one of the first things that I think it's the first thing that I usually ask a patient, and it's surprisingly, people often forget to present it to me right at the beginning, but they'll say, oh, my ear is killing me. And I'll say, well, how long has this been going on? When did it first start? And, so trying to understand the timing of a complaint, we call them complaints, and patients are always like, I'm not complaining, but that's a medical term for whatever it is that you're feeling, is very important. So we actually have 3 medical terms. The first is acute, then there's subacute, right? Which is kind of like suburbia between your urban area in a rural area, but it's basically like you have your acute things, your subacute things, and then your chronic things. So, acute things are things that come on suddenly. They're often dramatic, like a lot of pain, really
like my gallbladder.
right, high fever. You're fine one day, and then the next day, not fine. And those are things that are those are acute things. Now, sometimes those are flares, right, of a chronic problem. We call them acute on chronic, or an acute flare up of a chronic problem. But those are words that we use that talk about the timing and intensity. So things that are acute are sudden, they're dramatic. Things that are chronic are long lasting, have been happening. There's a story arc to them. There's often a repetition or things that can actually be understood, sometimes not, but basically they've been there a long time. And then the subacute things are somewhere in between when you're going through the transition phase between an acute problem. So for COVID, it would be like you're sick. And often long COVID patients, I don't know if you know this, but they're often not that sick. They often get like cold symptoms, maybe a little achy day, have a low-grade fever, shake it off, but then start to feel like they never really got better. Now they're having heart palpitations, or now when they just climb the stairs to their bedroom, they're short of breath, and that never used to happen before. So there's a transition period going from the acute symptoms that have now resolved to something else that is going to not resolve on its own so quickly. So I don't know if that answers the question.
No, that answered it perfectly. I had forgotten about the subacute, and then the acute on chronic was kind of interesting, that the way you phrase that, because I think for a lot of people there's a lot of that going on, and when do you go to a doctor? When don't you go to a doctor for whatever the flare may be?
A good example of that would be like when you get a cold and you're left with bronchitis. Do you know that? Like you get a cold, you're sick, you kind of go through it, it starts in your throat, it goes up to your sinuses, then you get the drip, then you start coughing. But the cough lasts like 3 weeks. And it's not going to be a chronic condition because you're just having a post-viral bronchitis and you just need some meds and maybe some steroids and maybe an antibiotic, you're going to be okay. But it's definitely not the acute phase, and it's not going to last, but it's dragging. Right. That's like a good example of like what would be that. Yeah.
Okay. Or in my case, head cold goes to pneumonia. So
okay.
yeah. But it's really interesting, because I think a lot of people nowadays, more than we think of, don't really know anymore. Do I go to a doctor? Don't I go to a doctor? Is this something I can just treat over the counter? A lot of people are afraid, especially during COVID. People have been afraid to go to doctors and afraid to go to hospitals.
And doctors have been afraid to see patients.
Yeah, petrified. I have several of my doctors. It's like, okay, they're as far away as they can possibly be, even though we're all masked. I had to ask a doctor to go check everything one day because I was feeling like there was something going on. And like you could tell, he was afraid to touch me. And I'm like, okay, well, somebody has to, because there's something going on, So with all of that, as a doctor, Dr. Becker, what do you say to people to help them, number one, feel comfortable talking to the doctor about things that perhaps their parents have always told them, tough it out, this too shall pass, or to somebody that has been disparaged by doctors, discounted by them, and not heard them, to help them sort of free themselves up to have a conversation, an open and honest conversation, app or no app?
Yeah.
What do you say?
It's a great question. Honestly, I think it's one of the gifts of telemedicine. I don't love telemedicine. In fact, when I had to stay home and just see patients over the computer, to be honest, I kind of hated it. Like, I just didn't like it. I like to be in the room. There's things you can only do with your hands, especially as a surgeon. We're proceduralists. We do all kinds of stuff to people. And so working on the computer was really hard. But there is a very nice place for, let's have a conversation. So if someone is interested and just wants to know, like, what do I do about this? Do I come to see you? Do I go to someone else? Like, let's take a good history. Let's do the first part of the visit, because the first part of the visit is talking. And the last part of the visit is talking. And then there's the exam in the middle. And sometimes we can't get that done very well on the computer, but that's okay. You can come and see me later for that, right? But for right now, if you just want to understand, like, what do I need to do? Like, what do I do? that's a wonderful place for telemedicine because it also is less disruptive for the patient, right? So you don't have to like get in the car, go to a place, find parking, pay for parking, figure out where the office is, wait 20 minutes in the waiting room, then sit in the exam room, then take your clothes off. I mean, it's a whole thing, right? So if you just want to be like, what do I need? Let's just talk. Telemedicine's great. And I honestly think that's going to be one of the revolutions that comes with this, with this sort of digital wave that's coming to healthcare that COVID forced in. I think there's going to be benefits like that come out of it, that change the structure of our relationships with patients. And I don't think it's 100% of a bad thing. I don't think you can totally take care of someone over the computer. Absolutely not. But I think it makes for different opportunities. And I think that's one of them. And you can also kind of see if a doctor and you gel, you can not leave your office, take 15 minutes out of your day to have a new patient appointment with someone and figure out that guy's a jerk. I'm not going to talk to him anymore. Next doctor, you can totally do that. And it's really a lot less skin off your back. So to answer your question, I think that's a big opportunity. And also, I don't think doctors expect that you to make your own. I actually don't like it when patients kind of make their own diagnosis. I like when they come with a lot of data, but I don't like a patient to come in and say, oh, I've had recurring ear infections for a year when I've never had them before. No one can figure it out, because I'm like, well, if no one can figure it out, maybe you haven't been having recurrent ear infections. Do you know what I mean? So a premature diagnosis and something that isn't resolved, I don't think is helpful. And so I don't expect the patient to be able to tell me, oh, do I need to see you or I don't need to see you? That's not your job, right? Your job is to come and say, something's wrong. Do I need you or not? And I'll tell you. So right. I think it's just being open with a question and being, not expecting too much of yourself as a patient, but just try to bring in all the information you can and let us do the sorting with you. That's what I think.
Okay, great. Tracey, you want to add anything into that?
No, if I ever had an ENT issue, I'm definitely going to see Dr. Marta.
Thanks, Tracey.
Yeah, with my whole ear issue after the car thing that triggered it, I learned how many different levels of ENTs there are as well. I always thought just go to my ENT, and my ENT was just an arrogant little ass is the only way I can describe him.
Well, that's not Marta, so.
No, totally not. That's very obvious at this point. And I went to another guy who actually ran a whole battery of tests, and he's like, I can't help you. I need to get you to this neurotologist researcher guy because I think I know what you have, but I don't deal with it, know? So that's interesting, Marta, that you talked about the whole telehealth helping create that conversation, because sometimes, it takes 3 months to get a physical appointment with some specialists, and then you get there and you're in and out in 10 minutes, but if you call with them somehow, that person can say, okay, I've listened to everything. I've looked at your data, maybe from Journal My Health. Here's who I think you should go to. And, you paid for that telehealth call or whatever it might be, or maybe you haven't. But I think that's a great thought process too, because a lot of people don't think about, I need to just have an intro call with a doctor. Yep. Concierge doctors do that a lot, right? Because they want to make sure you're a fit for them, and you want to make sure if you're going to spend $3,000 a year or more for a concierge, but that's not open to everybody.
Right.
So, Tracey, you were going to say something?
Totally lost my train of thought, but
sorry.
I was just no, it's okay. I just, I think what we're basically saying is this is a partnership.
Right.
With any partnership, sometimes you don't have the right person. Sometimes you need to move on, and it's okay. And I think that patients have to understand that. I'm not sure everybody has the ability to have a multitude of doctors. We live in an urban area. Marta and I actually live near each other, and we're blessed to have a cornucopia of people that we can see that's that are probably within an hour's distance of where we live. Not everybody has that opportunity.
It's a dearth where I am.
Right. So, and I think that we're going to see a lot more of that happening, I don't want to go down the telehealth, but certainly that's going to be something that can help. And then again, having that information of keeping those records. Again, this is part of your work. When we're not talking about acute at this point, we are talking about, something that is more chronic, or you're in a flare. But, knowing yourself, knowing what's right, what's wrong, even in an acute situation, just knowing what you can talk about, realizing what's happening, being in tune. That's part of what you should be doing. That's part of your job as a person, because the more information that you can give your doctor, I always tell my kids, I don't care if you think that it's the silliest thing. Exactly. That's not for you to determine. You tell them, because I have learned that, the little nummy tinkly thing that's at my forefinger is actually, that is a trail of breadcrumbs for the doctor or, my physical therapist.
Yeah. Astute clinicians will take batting practice with that stuff. They'll say, well, I got a new cat. And we'll be like, okay, maybe not the cat, but we'll put it over there. And you know what I mean? Like, it's a triage of stuff. Whenever everything I like to hear it all. People say, well, I don't know if this is important, but I got a new vacuum cleaner. I'm like, okay, cool.
And, I'll give you a quick example. And I know we're coming towards the end, before the fall before COVID, I had some rotten, it was probably a virus. I don't even know. I wound up in the emergency room. They asked me every question. Had I been on a cruise? Had I eaten a buffet? They had no idea what had caused, but they asked every single question. It didn't matter. At the end of the day, it was, something that they could treat. It needed to run its course. I needed not to get dehydrated. That was really the main thing. But it was amazing. Like, I hadn't even thought about eating at a buffet, but these were the questions that they were asking. And I was happy that they were, because maybe there was something that was out of the, like having some parasite or whatever you had from Israel. So I think it's important. There isn't anything that's too mundane for them.
Yeah, I love that. So last thought before we close up the show from either or both of you, last thoughts that you would hope people take away.
I'll let you finish, but I'll just say, I think journaling, like I said before, I think journaling is important for people. And I think journaling your health is a healthy habit to me, just like brushing your teeth. And I think our app's going to continue to expand and become more user friendly. Yeah. So, and we welcome people to visit our website and give us feedback, and ask questions, as much as it just helps us to understand what the consumer journey is and doctor journey. So,
yeah. And, I would say that we're in such a unique age right now. Healthcare has the ability to be further disrupted. We're seeing it on a daily basis. And, we have a supercomputer that lives in our hands. So how are we using that information? How are you as a person using the data that you generate on a daily basis? How are you using that for you versus giving that away to Amazon, which I do on a daily basis, basically, or, any other app? We have this ability to help ourselves. And, it's exciting for me to be able to take something that had happened in my life and combine it with what I've been doing, something sad that happened in my life.
Right.
But, use that and take my experiences and use my experience in the tech world, and the startup world, and bring that together so that we can actually, give, I hope, a better voice to the patient, and as well as the doctor too, and the healthcare provider. So, I'm very excited about this journey, and so glad that I got to meet Marta as she comes along with my craziness. as we do this together. And the folks over at Chariot, I'm happy. We're happy to have those partners as well.
Well, I'm just so excited that you guys came on the show. I know we had to postpone once before, and I'm glad to have you both here because I think this is a conversation that's so important in this day and age with all the changes that are happening in the world and the ever increasing number of chronic cases that are going on and the more and more demands on the doctors. I mean, Dr. Becker, Marta, just you working during COVID, I want to say thank you to that because I'm sure you were on the front lines a lot with people, having these respiratory and upper issues that they would go to an ENT for. So thank you very much for you and your staff's service during all this time. The fact that this is now something that a conversation is happening about and people are asking questions is so critical. That's why I wanted to have you on the show. And I'm a huge supporter of the two of you and the work you're doing.
Thanks so much.
Keep it up.
Thank you so much, Laura, for having us and letting people know about Journal My Health. And hopefully it'll help them on their health journey.
And where can they get the app? Is it iPhone only, iPhone, Android, PC?
Pure Android and iPhone. Very excited about that. And download it, use it. Get, like Marta said, give us the feedback. We want to continue to create a really good product.
Great. I love, seeing the progressions and all that. So we will be having further conversations.
Great. Thanks, Laura.
For being here.
Hope you
Oop, did I cut you off and you had a thought?
Nope, that was it. Just wanted to wish you good health.
All right. Thank you. All right, everybody. This was a different kind of conversation, but you know that I am all about making a difference and showing you some new questions to ask. So hopefully you will download the My Journal, My Health Journal, My Journal app and start using it. Start tracking your health, whether you have a chronic issue or not. Track how good you feel because you know what? Sometimes it's really helpful to track, I'm feeling good, so that you have something to compare it to. If you want to reach out to anybody here, you can get to them on their website as well, or just reach out to me and I'll give you their information. I want to thank you all for supporting me while I've been off the grid, and I am back now. So thank you, everybody, for all of your support on social media when you're like, where'd you go for the last month? But I am back. Have a great day, everyone.
You've been listening to It's All About the Questions, starring Laura Stewart. Connect with Laura at it'sallaboutthequestions.com and download a free workbook that will help you ask better questions starting today.